Hi, my name is Taylor. Today, I'll be discussing with you the infectious disease mumps. I'll be focusing on the cause of mumps, the signs and symptoms associated with mumps, as well as its methods of treatment. The clinical case definition of mumps, as defined by the World Health Organization, is the acute onset of unilateral or bilateral tender, self-limited swelling of the parotid or other salivary glands lasting 2 or more days and without apparent cause. The cause of mumps. Mumps is caused by a single-stranded paramonoxis virus. It is a contagious disease that is caused by the transmission of droplets from an infected individual. These droplets can be transmitted through the saliva and the nasal secretions of the infected individual, as well as close personal contact. The virus typically multiplies in the upper respiratory tract as well as in the nasal cavity. The symptoms of mumps. The symptoms of mumps can vary from person to person. However, the main symptoms that do occur within the first 2 weeks of exposure include fever, headaches, fatigue, as well as a loss of appetite. After these 2 weeks, the fever and the headache begin to intensify, and the salivary glands, particularly the parotid, begin to swell periodically. It is usually during these first 2 weeks that the infected individual is most likely going to pass the virus onto another person. Despite this, 1/3 of the people infected with the disease are characterized as asthmatic. This means that these individuals show close to no symptoms of the disease. If the infection is severe, the disease can arise to further complications such as swelling of the testes, inflammation of the brain, swelling of the meninges, as well as permanent unilateral or bilateral deafness. These severe and sometimes fatal cases are very rare, with most patients usually completely recovering from the infection within a few weeks from the onset of the first symptoms. Treatment. Due to mumps being a virus, there is no specific treatment available as the infection doesn't respond to antibiotics or other medications. Should any symptoms arise or you feel unwell, visit your nearest GP or pediatrician today. An evidence-based approach that a parent or caregiver should take in preventing and treating the infection is through vaccinations. Vaccinations should be taken as a measure of prevention, especially in children, to avoid future mump infections. The appointed vaccination for mumps is known as the measles, mumps, rubella, or MMR vaccination. The vaccine itself is given in 2 doses. The first dose is received at 12 months, while the second dose is received at 18 months. The vaccination is covered by the National Immunisation Programme scheme, which aims to increase national immunisation coverage rates by funding essential vaccinations for eligible infants, children, adolescents and adults. The Department of Health 2016. This means that the vaccination is free of charge. However, the vaccination should not be administered to individuals who are pregnant or who are suffering from an impaired immune system. These individuals, if they experience future mump infections, are advised to drink plenty of water, obtain sufficient rest, and ingest pain relief medication to relieve any of the common symptoms. For more information on mumps and the MMR vaccination, visit immunise.health.gov.au.
Created using Powtoon.